Hello, hello. We are live. We are live. Welcome to Medical Monday, where we talk about the medicine in the news. We touch on the hot health topics and the headlines. I am Dr. Frita, and I'm very excited to bring you some great topics that we have to talk about. Do y'all remember Iron Mike Tyson? I know you do. If you weren't living during his prime time, you've heard about him. Yes, you have. Guess what? He was set to have this great big fight with this YouTube influencer, but he had a medical emergency. That's right. He got nauseated and it was due to his ulcer. And so we're going to talk about Mike Tyson's ulcer and what happens when someone has an ulcer, like peptic ulcer disease. And if you're in a situation like he was on an airplane where you are getting nauseated and perhaps say someone passes out, we'll talk about what to do in an emergency, even if you're not a healthcare provider. And then how about tattoos? Raise your hand if y'all have a tattoo. I can't raise my hand. I don't have one. Although I did get this henna. Well, tattoos are very popular. I know you see everybody has them. It doesn't matter who you are. If you are a young lady with a little stamp on your back, if you're somebody who has a sleeve, man or woman, if you have a tat on your neck, if you have a tat, that means you've been in the big house. It doesn't matter. Tattoos are very, very popular. Well, guess what? There was a study that shows an association with tattoos and cancer. Yeah, I know y'all perked up now. So we'll talk about that headline and if tattoos really are associated with cancer. This is something you definitely need to pay attention to. And another thing you should pay attention to is the bird flu, because yes, we have more cases of the bird flu in the United States, as if we need another infection to send us into a lockdown. I'll talk about dairy cattle that's been affected, chickens that have been affected, and most importantly, what you have to know about the bird flu to protect yourself and your family. And then, we get to my most favorite part of these lives. I'm answering your questions right here on this live and on stage. Off the top, just, hey, ask me a question. This is important. If you want to ask a question today, you can join us on stage. Just put an orange emoji before your question and we'll know you want to come on stage, because we'll be talking about kidney health, specifically how one man donated a kidney and saved multiple lives. So please stick with us, get your live questions together. I am Dr. Frita. This is Medicine in the News on Medical Monday. Come on back. All right. Let's jump right on in. I can't wait to get going, but I can't do it alone. I got to have my co-host, Shador. Come on to the front of the class and let's get this thing going. How are you doing, Shador?
Doing well. How are you doing today?
Doing great. Doing really, really great. All right. Well, let's go ahead and get started. But before we jump into our first topic, I do want to touch on any questions we missed or any donations we missed. So let's throw up some of the things that we may not have gotten a chance to get to in our last live.
Absolutely. So we'll start with a question from Shannon Hill.
Hi, Shannon Hill.
This is from your How to Prevent Kidney Disease tips video. Hello, Dr. Frita. Should I be concerned with cysts in kidneys? I have one in each. I'm also type 2 diabetic.
Okay, that's a really great question. So cysts in the kidneys. So there are some diseases where you really do need to be concerned about cysts in the kidneys, specifically something called polycystic kidney disease. That is typically an autosomal dominant disease, meaning that if one person has it and has a child, there's a 50% chance that each child you have will have it. That's when there are multiple cysts. The kidneys are enlarged. The polycystic kidney disease is associated with high blood pressure, ultimately kidney failure. And we do, thank goodness, now have some treatments to help to slow down the process. That's that type, ADPKD. The good news for what you're describing, and remember, what I'm giving is information. It does not replace the advice of your physician, but what you're describing in general, when someone just has one cyst in each kidney, if it has been declared to be a cyst, a benign cyst, as in no cancer, then you typically have nothing to worry about. A cyst literally is just like a fluid-filled ball of cells. It's not cancer. It is something that's totally benign. Now, there are different types of cysts. If you've been told yours is a simple cyst, then just take the advice of your physician, but likely you're fine. If they told you it's a complex cyst, meaning that it has some divisions in it or septations, or if it has an abnormal shape, that might be something that you need to follow up with another imaging study. But in general, If you have just one benign cyst in each kidney, it's most likely benign. Now, you mentioned something else, is diabetes mellitus type 2. Now, that's going to be something very important to control. Why? Because it's the number one cause of kidney failure in this country. So you definitely want to make sure you have a well-managed hemoglobin A1C. Keep those blood sugars good, stay hydrated, make sure that you're having low carbs. And again, this is general information for you specifically. Make sure you consult with your physicians, but you want that diabetes under control. But yeah, definitely follow up with your physician. But from what you're describing in general, it sounds like something that's pretty benign. Make sure you check out my videos right here on this Dr. Frita YouTube channel, where I'm very proud to say we have over 725,000 subscribers. I have videos on diabetes mellitus, what added sugar does to your body, and it'll be able to give you some more information. Thank you for the question.
All right. Thank you. Have a super donation.
Oh, good. Thank you for the super donation. Appreciate it.
Denise Wonderful. She says, thanks on your
Thank
15
you.
foods to avoid if I have high blood pressure.
Wonderful. Thank you, Denise. Wonderful, for the 15 foods to avoid. I appreciate that. And stay tuned, because I just actually filmed another YouTube video where I did a field trip in the grocery store. They didn't kick me out. I'm surprised. Where I go over some other foods to avoid. So just stay tuned for that. If you make sure you subscribe to this YouTube channel and hit that notification button, then you'll be among the first to know when I release new content like this video coming up. I'm pretty excited about it.
All right. And one more question, shall we?
Oh, why not? We shall.
All right. This is from Linda.
Hi, Linda.
This is on how to prevent kidney disease. Dr. Frita, I read that when you have no gallbladder, you can't process and take in certain vitamins. Is that right?
Well, again, I want you to consult with your physician, and specifically a gastroenterologist if you have one. But in general, the reason that we're able to have people get gallbladder surgery where the gallbladder is removed, cholecystectomy, is because you really can function quite well, quite normally without the gallbladder. So I would consult with your physician specifically, but in general, not having a gallbladder should not keep you from taking vitamins.
Good answer. Thank you. And then one more super donation from Miss Rosemary.
All right, Miss Rosemary. I appreciate those donations.
And this is on how to prevent kidney disease video. She says, thanks.
Oh, my pleasure. Yeah, that how to prevent kidney disease. A lot of people are interested in it because oftentimes kidney disease is silent. And so, as you know, Shador, in our practice, patients are shocked when they show up and it's just like, ugh, you have advanced kidney disease. And they're like, well, why? I make good urine. I feel fine. I'm not tired. Well, that's because early on, a lot of times you don't have symptoms. And so in order to prevent kidney disease, I go over all the different things that you can do for lifestyle to keep your kidneys healthy. But something that's very important is knowing your numbers. So even if you feel healthy, even if you have no family history of kidney disease, you want to see that primary care physician to get basic labs, BMP, basic metabolic panel, and that can let you know through that BUN, creatinine, EGFR, estimated glomerular filtration rate, if you have a risk for kidney disease. Make sure you check out my YouTube video right here on CKD stages after we finish this live. All right. So let's jump into it, Shador. Let's talk about Iron Mike Tyson. Let me tell you, Mike Tyson was really, his career was really hot from 1985 to 2005. And I believe from 1987 to 1990, he was the undisputed world heavyweight champion. He had 33 knockouts. Like, I'm not even talking about just decisions. I'm talking about his opponents were knocked the heck out. And then 4 decisions. He had some infamous things to go on through his career as well. We won't focus on that right now. But, you know, he just really is a boxing legend. Well, guess what, Shador? He has been challenged. So Mike Tyson is now 56 years old, and he's been challenged by this little 27-year-old who apparently is a fighter. He's been fighting mixed martial arts fighters, and he literally has challenged Mike Tyson to a fight. The influencer is 27 years old. Mike Tyson is 56 years old. But Mike Tyson had a medical crisis on an airplane, so they had to postpone the fight. Before we get into this clip, first I want to ask you, who was the first person in our chat today, Shador? Uh-oh. Are you on mute?
Oh, I may be. I'm sorry. So first person name is Pat D.
Hi, oh yeah, hi Miss Pat D.
She finally got up. She's here every week.
Wonderful.
Welcome, Dr. Frita and Shador.
Hey, welcome back. I appreciate the support. So yeah, so we'll look at this clip. I'm talking about Mike Tyson, but I want you, if you have any questions about peptic ulcer disease or what to do if someone faints on a plane or if they faint in public, I want you to go ahead and put those questions in the chat. So any questions about ulcer disease or what to do if someone faints, because everyone should know what to do. All right, Shador, let's take a look.
All right.
Mike Tyson is on the mend after a health scare. On May 26th, the famous boxer was on board a flight from Miami to Los Angeles when he suffered a medical emergency. The 57-year-old's rep confirms to Page 6 that Tyson, quote, became nauseous and dizzy due to an ulcer flare-up 30 minutes before landing. He is appreciative to the medical team that were there to help him, noting that he's now, quote, doing great. Tyson's health incident comes 2 months before he's set to face off against Jake Paul in a boxing match, which will live stream on Netflix on July 20th. Tyson shared a poster of the match to its Instagram on May 25th and captioned the image, "Can't wait for Jake's wake," to which the 27-year-old YouTuber replied in the comments, "Titanium is greater than iron." Jake also called out Tyson on its Instagram page earlier this month, writing on May 13th, "Titanium Jake will sleep Iron Mike. The fun has begun." However, given the 30-year age gap between the opponents, fans are wondering if Jake will go easy on Mike. He tells TMZ in an interview on May 24th, "Absolutely not. He's ruthless. He's the most vicious champion ever. So I have to channel that Mike Tyson energy to finish him," adding, "and the legend must fall." In June last year, before it was confirmed.
All right. You know, this is very interesting. Oh, and remember when you're asking your questions to everyone in the chat, if you want to actually come up and ask the question live on stage, then put an orange heart emoji there, and then we'll hold off and wait, and we'll invite you up on stage to ask your question. Shador, what do you think about this? Like, Mike Tyson is such 11. Literally, this young guy is 30 years younger than he, and he thinks he's doing something. And you're not going to make a legend fall if you're battling him and you're 30 years younger. I don't think. But anyway,
He's a huge guy.
he's huge. He's huge, and he's been winning fights, and apparently he's very good. And even though Mike Tyson is the legend, Iron Mike Tyson, 57 years old is 57 years old. He's literally 30 years older than this man. In other words, it's just not, it's not an equal match. And Mike Tyson still may win, but if he doesn't, like, there'll be no shame in his game. This is not a legend that's going to fall. So, but that's up to Mike Tyson and whatever he's over there doing. But let's talk about his medical emergency. So yes, so as they mentioned, he had a flare-up of his peptic ulcer disease, his ulcer disease. So an ulcer is when you have a break or a defect or an erosion in the lining of the stomach. So you can have a gastric ulcer, an ulcer in the stomach. You can have an ulcer in the first part of your small intestine, or a duodenal ulcer. And the most common symptom would be pain, right? Just having a burning pain in the epigastric area, like kind of in the center of the stomach, right below the ribs. And let me ask this, put a 1 in the chat if you think that spices and stress cause ulcers. Put a 2 in the chat if you don't think that spices and stress cause ulcers. Put a 1 in the chat if you think that spicy food and stress can cause ulcers. A 2 if you don't. All right. So I will tell you the most common cause that we can recognize is a bacterium called H. pylori, H. pylori. And the good news is that if H. pylori is detected, like especially with an EGD or like an upper endoscopy where someone puts a camera down your throat to look, then we do have great treatments for it. Because truth of the matter is, not only can H. pylori be associated with ulcers, it can also be associated with cancer, like gastric cancer. So it's really important if you have ulcers to get checked out to make sure something more progressive is not happening. And the other thing that can happen with ulcers, like why in the world would he be nauseated? Well, sure, you can have a lot of acid and things like that and get a reflux. But something else that's really important is you can get a bleeding ulcer. And if you get a bleeding ulcer, then that can lead to a severe anemia. And some of the symptoms of a bleeding ulcer might be black tarry stools, like that digested blood that goes down. Oh, I feel like a digested blood that you start passing your stool. Or you can have a vomiting of coffee ground emesis, meaning you're vomiting and it literally looks like coffee grounds or like Coca-Cola. If this happens, you definitely want to go and seek professional help to see what's going on with you, because you can get severe anemia and it can even lead to you not being alive. So ulcers can be pretty serious. You know, another cause for ulcers will be taking excessive NSAIDs. So non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, naproxen, things of that nature can aggravate it. So if you have ulcer disease, you want to make sure, consult with your physician, of course, but you don't want to overdo it on the NSAIDs. And if you take like an antioxidant, an antacid or a Tums, and you find that the ulcer symptoms, that pain gets better, but then it gets worse, or if you have more pain, like when your stomach is empty or in between food, you definitely want to seek some professional help, because yes, peptic ulcer disease can be pretty common, but in some cases it can be deadly. One, if it causes you to bleed. Two, if you have the H. pylori that leads to cancer. And also, if the ulcer actually erodes all the way through the stomach wall or the intestine wall, you can get a perforation or a hole that can lead to an overwhelming infection, okay, which can lead to you not being alive. And it can even lead to strictures or blockages. So he had an ulcer. He ended up being nauseated. Who knows what the specifics were in his case, but just for all of us to know, ulcer disease is to be taken seriously. Now, who answered my question? Y'all know I like to have trivia questions by putting a 1 in the chat if you think that spicy food and stress can cause ulcers, a 2 if you think that they can't cause it. And just remember, please like this video as you're coming into this chat. It lets YouTube know that we're here and we're sharing evidence-based information. Make sure you like and subscribe. Any takers? Anyone came to the front of the class, Shador?
Of course. So I'll take the first 3 for yes and no, and then we have an interesting take. So yes, we have Aline.
She says 1, that they can cause it.
Yes.
Y'all know I'm gonna give y'all the answer. Okay, Aline, thank you for participating.
Gwen says 1, yes, they can cause it.
Okay.
And then JD Mind Tricks also gives a 1.
She gives a 1. Hi, JD Mind Tricks.
Now, my first 3 to give us a 2 that says no.
Now I want to know who the naysayers are. Who? I gotta know this.
Hall.
Whitney Hall.
V.E. Hall.
Or V.E. Hall. V.E. Hall says no. Okay.
77
says no, that spicy food can't cause it, or that stress doesn't cause it. Who else said no?
Kim K.
Kim K said no.
Yeah.
All right.
Interesting take. Cynthia.
Interesting take. Let me
she
tell
says
you what's
1 and 2.
Who said 1 and 2?
Cynthia. She taking the easy way out.
You know what, you on the fence, Cynthia.
But she could be possibly right.
Here is the answer. Spicy food does not cause ulcers. Stress does not cause ulcers. Huge common myth. I will say this for everyone, put a 1. Spicy foods can make ulcer symptoms worse, okay? And stress can make ulcer symptoms worse. But quite honestly, stress alone, spicy food alone will not cause an ulcer. The ulcer is going to be caused by the H. pylori bacterium. It's going to be caused by certain medications that can worsen or erode the lining of the stomach, such as the NSAIDs. These are the things that are more typical to cause ulcers. The spicy foods exacerbate symptoms. Stress will exacerbate symptoms. So these little naysayers, you know what, you little naysayers, you're right. And so 1 and 2, okay. 2, nah, it doesn't cause it. 1, it makes it worse. But yeah, I think it's a huge myth that no one really talks about. So cool. Thank y'all for participating. All right. So we were talking about the tattoos, right? And how there's a possible link between tattoos and cancer. Put a 3 in the chat if y'all have heard anything about this already, that tattoos possibly have an association with cancer. Because if that's actually true, I mean, we were just talking about Mike Tyson. Doesn't he have his face tatted up? Oh, child. All kind of people have their face. Who else has their face tatted up? Like Blueface and Krishan. Lil Wayne, doesn't he have tattoos? All kind of people. Chris Brown. Oh my gosh. A lot of people have tattoos. But if there's truly an association between tattoos and cancer, that could be very serious. But let's listen to a little bit of this next clip, and then I'll talk to you about the strength of the study. Like, is it just an association, or is there a cause and effect? But put a 3 in the chat if you had already heard something about this story. And remember, if you have a question and you want to come join us on stage, put an orange heart emoji by your question and we'll invite you up. All right, let's talk about these tattoos.
We have investigated the association between tattoos and lymphoma. And our study shows that tattooed individuals have a 20% increased risk of lymphoma. Lymphoma is a type of cancer that originates from the cells of the immune system. In Sweden, we have national registries that allows us to identify every individual who's been diagnosed with lymphoma. So that's basically what we did. We identified 3,000 individuals who were diagnosed with lymphoma between 2007 and 17, and 9,000 individuals who did not develop lymphoma. And we saw then that the risk of lymphoma was 20% higher among those with tattoos. Our study does not answer what's the actual cause in the tattoo ink that's driving the association between tattoos and lymphoma. But we do know from the literature that the ink that is injected in the skin does not stay in the skin, but that it's relocated within the body and ends up within the lymphatic system.
Okay. Yeah. So do we have any threes? Had other people heard about this study? I don't think it's been talked about all that much.
Yes, you have a 3.
Who heard about it?
Paula.
Hi, Paula. Okay. Yeah. So you heard her say that they did the study in Sweden where they really do a good job of keeping national registries to know which people have different illnesses. And they found that from their study, you had a 20% higher chance of having lymphoma, a cancer of the immune system, the lymph nodes. So, like if you ever have a sore throat or cold and you feel these glands under your neck that can be sore or big, or if you've ever, I don't know, pulled your ponytail too hard or got tight braids, or if you had a relaxer, if anybody is getting a relaxer, and you might get knots that pop up on the back of your neck, or if you had lumps in the groin or some type of an infection or urinary tract infection, those are your lymph nodes, right? Which are part of your immune system. Now, if you have cancer of the lymph nodes, that means that you're having an abnormal replication of this lymph node tissue that becomes uncontrolled and starts to invade other tissues. Okay. So that's cancer. So they found that there was a 20% increase, but she said it herself. They cannot, through this study, decipher if there's a cause and effect. In other words, we don't know all of the story. What if the people who had tattoos also happen to be people who smoke more cigarettes, right? Or happen to be people who drink more alcohol, or happen to be people who have something else, some other commonality that would increase their risk for getting lymphoma as opposed to just the tattoos. So the data is not strong on this study, but I did want to bring it to people's attention. So if you hear anyone saying as an absolute, oh, don't get tattoos, they cause cancer, that statement is not a true statement. The true statement is that in this one study, an association was found, but not necessarily cause and effect. But I do think it's interesting for the conversation because as she started to bring up, the ink does not just stay in the skin. It does go other places. So if you're someone who's on the fence about getting a tattoo, or you're just not sure, that information might be enough to sway you away from getting a tattoo. And of course, what we do know is that when you're using tattoos and you have these needles, you want to make sure that you're going to a place with clean needles that are just used for you, because hepatitis is something that can be spread if you're going to a place somewhere on the side of the road. You hear these different stories. I don't know. Has anyone watched the movie the movie Bridesmaids? Anyway, there's this one scene where the star has a roommate. The roommate has a sister, and that sister, oh my gosh, I can't think of her name, but she gets this tattoo that's clearly infected. And she said she got it on the side of a truck in Mexico and he gave it to her for free. Anyway, that's just something silly from the movie. But the point is, make sure if you do get a tattoo, you go to a reputable place with clean needles, because we do know that there's a direct cause and effect if you have an infected or reused needle with hepatitis. Now that can directly cause, hepatitis. And hepatitis, believe it or not, can cause kidney disease. Yes, it can cause liver disease. Yes, it can cause cirrhosis of the liver. Yes, it can cause liver cancer, but it can also cause kidney disease, among other things. So yeah, just something to check out if you have a tattoo. All right. Do we have any questions? Do we have anyone who's going to come on stage before this thing is over?
Yes, I think Miss Sonia wants to come on stage. So Miss Sonia, if you see the link in the chat. If you could click that, please, and I'll try to get you up here.
Yeah, we'll go ahead and bring her up even in between stories if we're able to get that going. All right. Sounds good.
I do have a question
Meanwhile,
from Miss Linda, though. She asked a question.
okay, hi, Miss Linda.
Is it possible dye gets into the lymphatic system?
Oh, yeah, definitely. It is possible that dye can get into the lymphatic system. And you know that our lymphatic systems are responsible for helping us to get rid of lots of toxins. We can help to bind toxins, bind bacteria, bind foreign materials such as dye, and remove them from the body safely. So definitely some dye gets into the lymphatic system. The question is there a direct cause and effect with that dye in lymphoma? And it's still possible, but the study, the way that it was presented, does not reveal that. It shows that there's an association, but at this point, it doesn't reveal that. We'll need more studies. And I think that we should have more studies, randomized controlled trials, ways to try to figure it out. Because tattoos are something, I mean, they're ubiquitous. They're everywhere in all societies, all cultures, all ethnicities, all races, all walks of life. And they're also getting more and more accepted. There was a time when if someone had a tattoo, it's like, oh, they're, a certain kind of a person, or maybe it's a motorcycle rider or somebody who, all up and through corporate, you see people with tattoos. And so stigmas that used to be associated with certain tattoos are no longer associated. So it's important to know. But the answer is yes. It can get into the lymphatic system. But the answer that we don't have is if it's a direct cause and effect for that 20% of the people in the study who had the 20% higher rate of lymphoma in the Swedish study. 20% is a big number, though. So we certainly should continue to get more data. We don't have enough data now, but I like presenting it. So it's food for thought. If you're considering getting a tattoo and you don't want one, or if you have a child or a grandchild and you really don't want them to get a tattoo, like if you have an 18-year-old going to college and she wants to get a tattoo and you need some data, you got a little bit of data. You don't, you can just present it how you need to present it. But yeah, thank you for that question.
Yes, thank you. Miss Sandra, she's on. If you could unmute your mic and then we can get you on here.
Oh, she's here? Okay, now who's this coming up? Let me see.
Miss Sandra.
Hi, Miss Sandra.
If you can unmute your mic for me, we can get you up here. All right, Dr. Frita, while she works on that.
Okay.
Another question? You want to go on?
Okay. So while we wait for her, we can get another question, and then we can talk real quickly about bird flu if we still need to wait after that.
All right. So this question comes from Miss Lakeitra.
Hi, Miss Lakeitra. Thank you for joining us.
Pertaining to the cyst. So what if it is on your ovaries, 10 centimeters, no pain?
Okay. So that's going to be different, of course, from a kidney cyst. I can't stress enough. You need to consult with your doctor, specifically your GYN, your gynecologist, because if you have a 10 centimeter cyst, that's pretty significant in size. Okay. And the fact that the cyst has no pain does not give us that much information, because if it were badness, which of course we hope that it's not, but if it were badness like cancer is usually painless. So having the no pain is not reassuring information, because if it were cancer, it would be painless. I will say, if it's been declared to be a cyst, that means that they've seen that it's fluid filled and that it's hollow. It's not a solid mass. But 10 centimeters, again, is pretty large. I would talk to a doctor, really get a good look at your family history, have that doctor to do all of the maximum imaging testing, like the abdominal ultrasound. They might even need to do a more in-depth ultrasound that GYNs or gynecologists do. They may even check certain hormones to screen for if they're suspicious or not. Is it just a random cyst? Is it polycystic ovarian syndrome? Most importantly, though, cancer must be ruled out. So please go see your gynecologist and then just make sure you ask all the detailed questions. And your driving question is, how can I be sure that this is not cancer? What do we need to do for follow-ups? You need to ask those questions, because again, 10 centimeters is a pretty significant size, but that's one for the gynecologist, your gynecologist, to answer. And good luck to you. Let's see. All right. No luck right now getting her up on stage. Shador?
No luck getting her up. But Jetty, she has a comment regarding the tattoos.
Hi, it's Jetty Mind Tricks.
Yeah, so she said, after I painted my house, I immediately want to change all the walls back to white. Therefore, I am not going to get a tattoo.
Oh, yes. Now, if you're going to get a tattoo, that's something that's pretty permanent. So if you're someone who's sitting here, as soon as you make a decision about color and design, you want to go change right back, then yeah, that might be that might be a sign, Jetty Mind Tricks, not to get a tattoo. Because as soon as you get a tattoo and you want, yeah, you can get tattoos removed, but it's pretty painful. And sometimes it can still be a little bit disfiguring. You know, your skin doesn't usually go all the way back to a same, you know, exact color. There will be a disruption in your melanin if you get a tattoo removed. All right.
Jetty.
Thank you, Jetty Mind Tricks. Y'all check out Jetty Mind Tricks. She has a YouTube channel right here. All right. Well, while we're waiting for our question, we can go on to our next story, Shador, and we'll just touch on bird flu really quickly, and then we'll come back and we'll see. If you have any questions and you want to come up on stage, put an orange heart emoji in the chat. Otherwise, we'll just keep flowing and we'll keep answering questions live right here in the chat. All right. The bird flu. I know y'all have heard about it.
Mm-hmm.
I can't stand flu. I can't stand any of these infections. Now, it's not the same as our typical flu season where the CDC recommends that from the ages of 6 months all the way up that you get vaccinated, because we know there have been different levels of the flu that have been to, you know, pandemic proportions that can cause people to be unalive. The flu can be transmitted from human to human, the kind of influenza like influenza A, influenza B in the flu season. The bird flu is something that is different, but the reason it's making the headlines is, Shador, it's been taking out dairy, cattle, birds. There's even been one recent situation where over 4 million birds had to be unalived because they were infected with the flu. And here's what's really interesting. We now have at least 3 cases of humans who have been infected with this bird flu that's out. Right now, we're not documenting any human-to-human transmission in this bird flu. So if you're not a dairy worker, cattle worker, poultry worker, your risk is limited. But you know, a lot of these infections start somewhere, and it is possible to mutate. So let's look at this clip and let's talk about what we need to know about the bird flu.
All right.
The latest bird flu outbreak has affected more than 60 dairy herds since late March, according to the CDC. Public health officials say they're testing vaccines in case they're needed. Fox's Jonathan Seri has more.
As bird flu spreads among cattle herds, the CDC says it's preparing for a possible increased risk to human health from the virus. Though doctors caution there is still no evidence of person-to-person transmission in the U.S.
It's a very similar virus, but it doesn't seem to attach as well to human cells, which is why it's thought to be a fairly low risk.
The CDC says bird flu has affected herds in nearly a dozen states as of last week. On Friday, the U.S. Department of Agriculture announced the virus had been detected in beef tissue from a sick dairy cow, but says the meat did not enter the nation's food supply. So far, only 2 farm workers have tested positive for bird flu this year, one in Texas, another in Michigan. Both had contact with infected animals.
We have specific guidance for those who work on farms in terms of personal protective equipment and how to be safe, how to monitor for symptoms, what to do if they develop symptoms.
Meanwhile, the U.S. is taking steps to develop or acquire vaccines that could be used to protect at-risk workers. Last week, public health officials said they are filling about 4.8 million doses of bird flu vaccine into vials through a national stockpile in case they are needed.
We're really prepared to not only test the current vaccines that we have in the stockpile, but also to really develop specific vaccines. So
Okay.
Very good place.
So yes, that's just one of these things that we need to be aware of. Again, right now there's no human-to-human transmission, but I know that on one of the strains that was found in a human, presumptively from, you know, one of the cattle, it had one of those proteins, H5. And, the flu, I won't go into detail today, but if you check out my video on Influenza Explained right here, I go into detail about the flu that we worry about as humans from year to year. And you have these certain proteins on the surface of the flu virus, H and N. And I go into detail about, how they're transmitted from human to human, animal to human, all the things you need to know. But this bird flu, because now that we've had at least 3 cases in humans, it's something to pay attention to. It's something to pay attention to. Now, one good thing, they talked about the PPE, right? The personal protective equipment. For at least some of the people, or at least one who got infected, that person was not wearing proper PPE, meaning they didn't have a mask. I know at least one person got a conjunctivitis, right? An infection in the eye, which probably came from some splashing of infected material, infected body fluids from the animal. And so they're, recommending that they wear this protective equipment to be safe. But it's really unfortunate, that these animals are being slaughtered, and who knows what that's going to do to our food supply. So I do feel very bad about that. But very importantly, just really pay attention, stay updated with the news. So, when you come here to Dr. Frita's Medicine, the news, I'll keep you updated, but prayerfully it won't get to a point where it's human to human. But these infections start somewhere. And so you can say that you heard it here. The bird flu is out here. We got more humans getting it. Just make sure you're careful. If you are someone who works with birds, works with dairy, or if you're someone who eats beef, if you eat chicken, make sure you're paying attention, looking at CDC recommendations on if you are in an area where the food has been infected. Right now, they're saying no, the food is safe, but things can change quickly. So stay tuned. Stay tuned. All right. Any questions, Shador, before we move to our next story? Or was Miss Sandra able to connect to us on stage, or any other orange hearts?
Mike and camera connection. So we'll see.
Okay. All right. So y'all can keep asking questions. If you want to try to come up on stage, then again, put an orange heart in the emoji with your question. But other than that, just keep asking the questions live. Very importantly, please make sure that you like this video as you come in. It really does help our channel, helps us to keep giving you evidence-based information. And if you have some questions that you don't necessarily want to ask here, then we do offer a concierge service. So make sure that you click the link in the description, or if you just go to my website, dr.frita.com, DRFRIT, as in take care of yourself, a.com, you'll get links to everything. But for the concierge service, that's when I take out an hour where we can talk one-on-one, and we can do it via telehealth. And I actually can give you detailed, specific information, as opposed to just the general information that's not advice that I give here. So yeah, make sure you check out the concierge service if you have a pressing question. And I know for those of you who've been with us, like Miss Pat D, you know that I am a board certified nephrologist, meaning I'm board certified as a kidney specialist and a high blood pressure specialist. I also, did an internal medicine pediatrics dual residency, after which I got my board certification in pediatrics. I got my board certification in internal medicine. And just this year, by the ABOM, the American Board of Obesity Medicine, I became board certified in obesity medicine. And so even though I practice as a kidney specialist, I like to know a lot about a lot. So please just check out the concierge service. Even if you just want to run something by me, a second opinion, or get an outlook, I'll definitely give you honest, thoughtful conversation, and I'll keep it evidence-based. All right. Let's see. Any questions before we move?
Yes,
Okay.
ma'am. I have a question and a comment, funny comment. So this question is from Theo Polis Stewart.
Hello.
Why is the bird flu found in cows?
Very interesting. That's a good question. So it's called the bird flu, but the same way that the bird flu now is found in humans, it looks like there's been some animal to animal transmission of it. And what happens, which is why this is the other thing that's scary, once it gets into the genome of a certain organism, just like right now we have some humans, we worry about these smart viruses being able to mutate, making them be more likely, once they're in a human, to become human to human. But usually when they call it something like that, the bird flu or the aviation flu, that's where the original source was, but it can jump to any animal, as you can see, including the human.
Mm-hmm.
Yeah.
Speaking of any animal, internationally known law.
Hi, international. Hey, you're back. Hi, internationally known.
Law, not my lamb chops.
You know what? Now, don't even start that. Now, I already said that the CDC has not declared any food to be unsafe. But look, I know one thing though, if you do eat meat, I'll be checking out these advisories from day to day, just to be sure. Yeah, the CDC, I have to say, they really are on top of it. So I do feel safe right now with the poultry and the beef, but pay attention, because you know how science is ever changing, and so are infections.
Absolutely.
Yeah. All right. So now let's talk about my specialty, the kidneys, because we have kind of a feel-good story here where someone donated a kidney that has changed multiple lives. Let's play that clip, please.
It's time for a GMA cover story about two brothers and a stranger connected by a life-saving kidney transplant. El Reshif has the story. Good morning, El.
Good morning to you, George. These three lives are now forever interconnected. Clay's selfless act of love for his brother, giving the gift of life to a stranger.
Dun, 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 dun. When Clay Garcelli decided to donate his kidney, the Californian didn't know his choice would change not one, but two lives.
How do you feel?
I feel wonderful. Thank you so much.
That's great to hear.
What started it all? Clay's younger brother Carter needed a kidney.
It wasn't really like a question for me whether or not to do it. I was just going to do it. And I just wanted to help him get as healthy as he possibly could and do the things that he wanted to do in his life.
Preliminary testing showed 26-year-old Clay wasn't a match for his brother, but UCLA Health has a kidney exchange program. Clay's donation to a stranger guaranteed his brother a compatible kidney from someone else. In December, Clay donated his kidney to 57-year-old Sonia Glover, who had been waiting for a match for almost 10 years.
He's my angel. I told him and his wife, like, we're connected forever. You guys will get random cards from me. It's like, it's like you're my family now.
Watch the emotional moment they met for the first time.
Thank you so much.
22-year-old Carter, at home on dialysis, waited anxiously for a match.
Because I had gotten so used to not feeling that well, I didn't notice how bad I felt.
And in February, Carter got a new kidney from an anonymous donor.
I feel great. I'm able to go out and do stuff again. Like, I feel so much better.
Clay, always a hero to his little brother, even more so now.
There's not enough I can do to thank him for what he's done for me. What he did truly did save my life. I can't thank him enough for it.
Shador. Now, let me tell y'all, that is a feel-good story. I want y'all to put a 4 in the chat if you've heard of that kidney exchange program. Because let me tell you right now, as you sit here on this Medical Monday, Shador and I witnessed this firsthand in our practice on a regular basis. We've had patients, husband and wives, where the wife, in our cases, the wife has wanted to donate to the husband. The wives have been healthy enough to donate, but they weren't a match for their husbands. And in at least 2 of our relatively recent cases, they went into this kidney exchange program. The wives donated their kidneys to perfect strangers, and then perfect strangers, relatives or friends of whoever they donated to, donate their kidneys to our patients. And so this program is real. This program has been around, and it really changes lives. So if you're someone who is living with kidney disease and you have someone who's willing to donate and you're just like, oh, they're not related to me. Oh, shoot, they're not a match. Or even if they are related to you, like this brother, please allow them to give you that gift. They want to give you that gift, because even if they're not a match, you can do the kidney exchange, like a kidney swap, and still save a life. It's the most beautiful, most emotional thing. The other thing that's beautiful, well, as you see exemplified in this clip, we're living in a world that's often, so divided, and everyone's on this side or the other, be it from politics or race or gender or whatever. But when it comes to giving the gift of life, life is that one unifying factor. And it's the most beautiful, harmonious gift you can possibly give to someone. I mean, it's just beautiful. So I just love that story. It's a good feel-good story. So we'll go ahead and we'll talk a little bit about donation. Please go ahead and put questions in the chat, but I'm gonna talk a little bit about donation. And if you're someone who's living with kidney disease, or someone who has kidney disease, and you have a question about the different types of dialysis, home dialysis, what allows someone to be qualified. If you have a question like, hey, if I donate one kidney, am I stuck with half of my kidneys? Half the kidney function. That's a common question. Go ahead and put your questions in the chat, and then I'll start talking. Do we have anyone who wants to come on stage right now, Shador? Anyone with a question right now?
No, but I do want to get to Miss Sonia's question. She wasn't able to come up, so I just want to ask for you. We're going to go back a little bit to the tattoo stories. She asked, hi, Miss Sonia. Sorry.
Hi.
She said, are all levels of ink created equal?
What's that?
Are all levels of ink created equal?
No, no. I mean, and you can imagine that when you have something that's in the red family, the black family, the blue family, something that requires more pigment, that might require more needle punctures or even a deeper piercing into the skin, you're going to have different levels. So I would just really do research from, yes, tattoo professionals, but more importantly, especially if you're someone with a family history of cancer, or if you've had a history of an autoimmune disease or some type of an issue with your immune system, then I would really strongly consult with my primary care doctor and very much your oncologist if you have one, and find out the risk and is it worth it. And again, the study is not saying cause and effect, but that 20% that they found in Sweden is enough to give one pause if you're already kind of on the line, or if you're someone who's at risk for cancer anyway. But yeah, the different inks can have different potency, different strengths, and certainly, depending on who the manufacturer is, there can be different ways that they can react with your body and with your lymphatic system.
Thank you.
Okay.
All right.
All right. So as I get ready to talk about kidney transplants, in the chat, because I know we got all kinds of brainiacs in the chat, I want y'all to please list causes of kidney failure. Just list like one cause of kidney failure, and then we'll get into that. But meanwhile, getting to transplant. So we talked about transplant here quite a bit, and I was really excited back when we had the pig kidney transplant. We talked about that some more last week because we had the world's first successful, at the time, living pig kidney transplant in March into a 62-year-old Mr. Rick Slayman. I was so excited. But then we know that he passed away last month, just within 2 months of receiving the pig kidney. Even still, they're saying that the kidney was functioning well, which does make sense, because if the kidney had the kidney started to decline in function, then they could have simply put him on dialysis if that was the answer. We still don't have all the answers. I have heard that he had congestive heart failure. We know that it was a compassionate transplant, but either way, I'm just really appreciative of him, Mr. Rick Slayman. So I do like to call his name for his contribution to science. But that was the pig kidney. With the human kidneys, we do have, much more success. And I've had patients who've had kidneys for well over 20 years, pushing 30 years, even though that is not the average life expectancy of a kidney. So here's the deal with the kidneys. We know that our kidneys are located in your lower backs and the flanks where your love handles are, right? And the kidneys are responsible for filtering out toxins, filtering out excess water. They're also responsible for helping you to not be anemic. They're responsible for good bone health. You may not know, kidneys are responsible for activating your vitamin D. Okay. They help to regulate electrolytes like your sodium, your potassium, and how alkaline or acidic your blood is. The kidneys do that too. The kidneys are very exciting. Am I biased because I'm a kidney doctor? I don't know. But the kidneys are some bad mamma jammas. And here's the thing. If your kidneys stop working, if both the kidneys stop working, you cannot live. Okay. If both kidneys stop working, you cannot live. And it's interesting because I'll have patients who come in and they might have kidney failure or chronic kidney disease. And they'll be like, okay, doc, that's the function you're telling me on my kidney, but how about my other kidney? And what I explain is that the blood work you get is giving us the work that both of your kidneys are doing. So if you are in kidney failure or if you have CKD, that means that both of the kidneys are having an issue, because you only need one kidney to survive and to survive well. You need one kidney to survive and survive well. So if you're a healthy person and you want to donate a kidney, but you're like, gosh, if I donate my kidney, I'll be stuck with just half my kidney function. That's not so. That one kidney you have will bulk up and do the work of two kidneys. Okay. So you're not giving up half your kidney function if you donate a kidney. You're just using the one kidney that you need. And something that's really important is that for the transplant clinics, they not only protect the kidney patient, right, the kidney recipient, they're also very protective of the kidney donor. So if you have diabetes, nah, you can't donate a kidney. If you have high blood pressure, you can donate it if that blood pressure is well controlled on just a couple of medications. If it's malignant hypertension, really poorly controlled, no, because we know high blood pressure is the number 2 cause of kidney disease. Ooh, I just gave one of my own answers. One of the 2 causes, the number 2 cause of kidney disease. All right. So I'm gonna take a pause as we're talking about transplants. Did anyone throw out any causes of kidney disease?
Yes, they did. You gave out 2 answers: diabetes and hypertension. I'll take those off the board. Sorry. Theopolis says not enough water.
Yes, I'm glad you said that. Okay, I'm glad you said it because that is like not a very well known. But if you don't have enough water and you are dehydrated, it can cause something called pre-renal azotemia. Pre-renal azotemia. Okay, and would you believe this? I have actually had to dialyze patients, okay, because of severe dehydration. Okay, Theopolis. Yeah, so that's a very good one. So when we sit around saying, get your water, drink your water, some people say, oh, I'm not thirsty. By the time you're thirsty, you're already behind. Okay. Your volume is already behind. So you want to make sure, consult with your physician to find out what's the right amount of water for you. For most people, it's somewhere between 2 or 3 liters. So if you think about like a 16-ounce bottle, so something like 4 to 6 of those a day. Yes, that's a lot of water. Ooh, that talk is making me thirsty. And there's some controversy on drinking out of bottled water, like some of the substances that can potentially get into water. That's a whole nother talk. But yes, not drinking enough water can cause kidney disease. Make sure you check out this channel right here, Dr. Frita, where I have a comprehensive YouTube video on the importance of drinking water and how, yes, drinking water can help you to have healthy kidneys. All right, that's a good answer. Anyone else? Anyone else?
Yes, Aline.
What did Aline say?
If blood supply is not flowing properly.
Boom, boom, boom. That's exactly right. And there can be some different things that keep the blood supply from flowing properly. One, you can have atherosclerosis, right? Or some plaques in your renal arteries, and that can cause a renal artery stenosis. Okay. And so imagine if you're someone with really bad artery disease and you have poor circulation, heart disease, high cholesterol, all kinds of, you're a smoker, atherosclerotic plaques everywhere, or if you're just genetically predisposed, if you mess around and have 2 kidney arteries, if the arteries to both of your kidneys are compromised, you have poor blood flow, that absolutely can cause kidney failure. That's a good one. Look, I wasn't even thinking about that one on the top of my head. Very good.
Yes,
all right.
Yeah,
Anyone else now? Okay, who we got?
BAP.
Hi, BAP.
Too much NSAIDs.
That's it. Yes, too much NSAIDs. And so we talked about those NSAIDs with the ulcers, but yes, NSAIDs can lead to kidney disease. Now, I'm not demonizing all NSAIDs. When I say NSAIDs, I'm talking about non-steroidal anti-inflammatory drugs. So like ibuprofen, Motrin, Aleve, naproxen, Celebrex, meloxicam. Have y'all ever been to the orthopedic doctors? They love giving meloxicam. But these anti-inflammatories, if your kidneys work well, if you're well hydrated, you don't have an NSAID allergy, if you use them as directed, they're probably fine for you. Consult with your physician. But if you're someone who already has CKD, or if you have diabetes, high blood pressure, especially if they're not well controlled, or if you're dehydrated, then the NSAIDs, especially the overuse of NSAIDs, can put you at risk. I know I've had a lot of patients with like rheumatoid arthritis who have chronic pain, or lupus and they have chronic pain, and they're taking high doses of NSAIDs pretty frequently, and they show up and they have kidney disease and they had no idea. Just because it's over the counter does not mean that is safe. So I'm glad you brought up the NSAIDs. That's not one of the obvious ones that people know. Yeah. Okay. All right. Before we get into any more questions, I'll just finish up what I wanted to say about the transplants. If you have kidney disease, then make sure that you, again, allow people to be a blessing. I know I have patients who have children. They're like, oh, I'm not going to let my children donate. Listen, if you're a good parent, and if your child has that love for you, and your child has to be an adult to donate the kidney, please don't block that blessing from your child. And of course, everyone has to make an individual decision. But I have had patients whose parents would not let them donate the kidney, and those parents have gone on to be unalive. And the children are so frustrated and so upset because they've wanted to give that gift of love to their parent, but they were blocked. And by the other token, Shador and I have a patient right now whose daughter donated her kidney to her mom over 20 years ago. Both mother and daughter are still doing fine, still going strong. Okay. You only need one kidney to survive and to survive well. And the transplant centers will not let you donate a kidney if you're not healthy enough to do so. They're very protective of the donors. But, we do have a shortage. We know that 17 people die each day while waiting for a transplant. And even though, we've had, like, I think in 23, something like 27,000 kidney transplants, human kidney transplants, of course, we had 89,000 people who didn't get who needed transplants, so we still are very short. So I encourage you to be an organ donor. Talk with your physicians, talk with your family. I'm an organ donor. When I'm gone, I don't need my organs. So why won't I donate them? That's my perspective. All right. And then what else I want to say about transplants? Once you get a transplant, this is a common question that I get. They don't take out your old kidneys. Like if you don't have kidney cancer, then they leave your 2 kidneys in and they put the transplanted kidney like in your pelvis, okay? Like in the front lower part of your stomach. So if you get a kidney transplant, you are chilling with 3 kidneys. One of course is the one that's functioning, and they attach it to your blood system and to your urine system, to your ureter. And in order for your body, so yes, they make sure that you're a good match, but in order for your body not to reject the kidney, you are required to take immunosuppressants or medicines that push your immune system down so you're able to keep the kidney. And, and Shador and I see a whole lot of kidney patients. And once you get that transplant, it does add to the quality of your life and actually adds years to your life. And so even if you're someone who maybe is a little timid and you're not sure if you want to get a transplant, like if you're a dialysis patient, at very least go and be evaluated by the center. And evaluation doesn't mean they're going to snatch you and put you on the table and make you get a kidney, but just make sure you're well educated, because I have really good experiences with my kidney transplant patients. And I'm really excited about that story about the kidney swap. But I really wanted to give you all an example of what we see every day in our practice. It's a real thing. It works. Yeah. Yep. All right. So I think we're about time to wrap up soon. Do we have any other questions before we slide on out of this medicine in the news, Medical Monday?
Of course, we always have questions, Dr. Frita.
Oh dear. We'll just hit on. We're gonna hit on just a couple of them, and then we're gonna slide on out of here.
All right. This comes from Miss Linda.
Hi, Miss Linda.
What is stage 3A CKD?
All right, Miss Linda, that is a very specific question, and I have a very specific answer. So stage 3A CKD, there are 5 stages of CKD, which is chronic kidney disease. One is the best, where you essentially have normal kidney function, but maybe you have something going with your anatomy, like polycystic kidneys, or maybe you have a horseshoe kidney where the kidneys are connected on the bottom, but normal kidney function. That's CKD stage 1. All the way to stage 5, which is when your eGFR, or like your percent kidney function, is less than 15 and you're eligible for dialysis or a transplant. Stage 3 is the middle of the road, okay? And so stage 3 is when your kidney function is somewhere between 30 and 60. If you have been declared to be in stage 3A, or if there's a loved one who's been in stage 3A, that means that eGFR, estimated glomerular filtration rate, is between 45 and 59. Okay. So you're in stage 3, the moderate kidney disease stage, but you're on the better end. Here's what's important to know. One, if it's you or if it's a loved one, have them to look and to know their numbers. They're going to see that eGFR, and it's going to be between 45 and 59. They're also going to take a look at their BUN, their creatinine. If your GFR, this is general you, not just you, Miss Linda, because you could be asking for a friend, but if the GFR is less than 60, it is standard of care to be referred to a kidney doctor. Now, oftentimes the primary care doctor might see that it's less than 60, tell you a few things to do, drink some water, do this, stop the salt, let's get the blood pressure under control, and they might bring you back to see if it's going to get back up above 60. But if your GFR, estimated glomerular filtration rate, that percent kidney function, if it's persistently less than 60, then it is standard of care for you to be referred to a nephrologist like myself. So if your doctor hasn't brought it up to you or to your loved one, please bring it up. Be your own advocate or be your loved one's advocate, because as kidney doctors, we can really go into detail. Please, Miss Linda, when we finish this live, make sure you go to my YouTube video right here on this channel. I go into detail on CKD stages explained. I'll tell you what to expect at each CKD level, what electrolytes tend to be normal, what symptoms you might get, what dietary changes you may need to make from level to level. And of course, it's information. Still, you need to be seen by a physician and specifically a nephrologist, anyone whose GFR has dropped to less than 60. Thank you for that question.
All right,
Yeah.
thank you.
The other good thing about that, I'm just going to say this with the CKD3, before, years ago, and when I was in training, we really didn't have much we could do, but now there are actually some medications that can help to slow down the progression of CKD. Ask your doctor about that too. Mm-hmm.
All right, thank you, Dr. Frita. Next question is from Jesse Lewis.
Hi, Jesse Lewis.
What is happening to or in the body when you are told your kidneys are slightly dehydrated?
Okay, that's good. So if you're told your kidneys are slightly dehydrated, you may be wondering, like, how can the doctor look at your numbers and know that your kidneys are dehydrated? How do they know it's not blood pressure or salt or whatever? Well, I'll tell you. We are able to calculate, Shador knows, we calculate in the office. We're able to calculate something called FeNO, or fractional excretion of sodium. And we can look at your urine electrolytes, your blood electrolytes, and we can figure out that if your kidneys are working below the normal level, we can figure out if it's because they're dehydrated by calculating that number. The other thing that we can do is we can look at your urine. You know how you do those little spot urine checks? Well, if your urine is very concentrated, like if it's not filled with enough water, but it has too many solutes, it's concentrated, then your specific gravity, SG, specific gravity will be high. So if your specific gravity is higher than like 1020, 1.020, that's one way your doctor might look and say, oh, your specific gravity is high. Yeah, we can tell you're a little dehydrated. The other thing we can look at sometimes is the salt level in your blood, your sodium. For most labs, it'll say your sodium should be somewhere between 135 and 145. But if your sodium is high, 146, 147, or if it's really in the high 140s, that could be an indication that you're dehydrated. Why? Because if you have less water in your body because you're dehydrated, that means the salt will have a higher concentration. That makes sense, right? You can just imagine you pour the same amount of salt. Say you pour, 2 tablespoons of salt in 2 different containers. If you fill one container all the way up with water, but the other one you only fill halfway up with water, if you were to check the sodium concentration, the container with the least amount of water would have a higher sodium, right? Same thing with the blood. If you're someone who's dehydrated, you don't have enough water in your blood, your sodium concentration will be high. So sometimes your doctor will look at that and say, oh, you're a little dehydrated. So we have all kinds of tricks to figure it out, and including your physical exam. If your lips are dry, if your tongue is dry, if your doctor pinches your skin and you get tinting, that's usually when the dehydration is pretty severe. But like if they pinch your skin, it should pop right back. Pop, pop, be supple. But if you pinch your skin and it kind of sticks and it takes a while to go down, they call that tinting. If you pinch it and it stays in the tint for a little while, that could be a sign of dehydration, usually more severe. But either way, drink enough water and check out my video on the importance of hydration for keeping the kidneys healthy. I like that question.
It is a good question. Speaking of water, Miss Mona Melissa.
Hi.
What's the best water to drink? There are so many opinions. It's confusing.
Oh my goodness. Okay. You know that what I provide on here is information because there are so many different waters. There's alkaline water, which I know has a big kick. And, you go to buy your alkaline water, they want to take every piece of your bank account and every part of your savings account and your checking and your SEP account too for you to pay for alkaline water. Alkaline water is not for everyone. And then you have, the different name brands of water. You have the smart water with electrolytes. But say you're someone who has advanced kidney disease and you have potassium that's already too high in your body or calcium that's already too high in your body. The electrolyte water might not be for you. So the short answer is this: you want to consult with your physician to find out what water is best. When you have water that's distilled or filtered, that's going to be protective, making sure that it doesn't have certain things like lead, that it doesn't have, other kind of toxins and poisons. And unfortunately, some people live in areas where even though the EPA is supposed to help to protect us to make sure all of our water is clean, everyone's water is not clean. So sometimes, just even buying a simple water filter, if you don't have one, like in your refrigerator, you can buy a water filter that will help you. But in that video, I keep mentioning that water, I actually sit down and I go through in detail the filtration processes of different water. And I talk about the level of alkaline, how alkaline different waters are. So if you watch that, again, it's information. It doesn't replace the advice of your physician, but if you watch that, it will definitely open your mind and give you more education on what water might be right for you, knowing what is going on with you, you know. But yeah, that question, there's so much water, and some of the waters are just expensive with their fancy bottles, but it's no better than my tap water. But I go into detail. But yeah, watch that video on the importance of drinking water right here on this Dr. Frita channel after you finish this live.
All right, just a few more questions and comments.
Okay, okay.
This is from
I
Robo
love when
Gamer.
y'all ask questions. I love these live, right here, real-time questions.
Oh,
And
yeah, the
again, as
question-
you ask these questions, they're always smart questions. You always have me thinking on my feet, which I love to do. But yeah, make sure you do like this video, subscribe to my channel, hit that notification bell. And, you know, and right here, yes, we do these lives, but I have a whole lot of content. You know, we've been doing this channel. I have well over 200 videos. And for most things, I have something to do with kidneys or even heart disease or even gallbladder cancer, if you can remember, if you can believe it, how to unclog your arteries naturally, what foods help to repair the kidneys, the truth about kidney detox. I talk about lupus. I talk about kidney stones. I talk about mental health. I talk about exercise. I talk about, you know, the truth about vaccines. You'll find videos for many, many topics. And if you have topics you want me to talk about, make sure you go ahead and ask, and we'll see if we can do them. So that's on this YouTube channel. But if you check out my Instagram at dr.frita, that's where I have a lot of short content. Plus, I have some personal things that go on. You know, I'll be fussing about my kids or my families, or sometimes we're having enlightening information. Yeah. Oh, check out my Instagram, because on this past Friday, I actually did a quick Instagram live while we were driving on the highway. Child, somebody had an accident. It was a mess. But I'll give little short bits of content in my little commentary if you check out the Instagram. I'm also on TikTok and all social media platforms. All right. What are the questions, Shador?
This is from Robo Gamer.
Hello, Robo Gamer. You know what? My kids, it's summertime. My kids are on the game. But you know, my niece is visiting me. She and her husband, in fact, they're out with the kids right now. They're in their 20s and they're gaming too. Everybody's gaming. I guess people my age are gaming too. I'm not. I'm just fussing when my son asked me if he could buy these expensive games that are virtual. You can't see them, you can't touch them, you can't feel them. I tell him no. But what's your question, Robo Gamer?
How many times should we do a number 2 per day?
Okay, that's going to vary, you know, and you'll have, so certainly consult with your physician. I almost don't even want to touch this question because it's going to vary from person to person. You'll have some gastroenterologists that say you should have at least one bowel movement a day. You'll have some who will say every time you eat, especially if you're eating plant-based foods or fiber, you should have one every time you eat. What goes in must come out. And you'll have some who will say that as long as you're having one every 1 to 3 days, that's normal. That is a question that's going to vary. It's going to differ depending on what's normal for you. But what is going to be good for essentially everyone is staying well hydrated, making sure you have a diet that's high in fiber, that's mostly plant-based, and that's allowing you to, that fiber, yes, it's going to help you to have bowel movements. The fiber is also going to bind to cholesterol, specifically bad cholesterol like LDL and triglycerides, and that's going to help you to unclog your arteries naturally to have low cholesterol. But please, you're going to have to consult your physician because movements vary from person to person. I'll tell you right now, if you're sitting there and you haven't had a movement in days, and especially if you're having stomach pain, things of that nature, or pain that's down low, that's near the place where it comes out, then you definitely want to consult with your physician and find out what you need to do to switch up your diet or your hydration. Or even there's certain diagnoses that can cause constipation. Sometimes, I'm not speaking this into your life, but sometimes a presentation of masses in the intestine can be not having bowel movements. I'm not speaking this into your life, but it's just one of the possibilities. Consult with your physician to get things regular. Thanks for the question.
All right, thank you. This comes from Miss Ebony Bell.
Hi, Miss Ebony Bell. I like that, Ebony Bell. Okay.
Does high oxalate foods cause kidney stones?
Yes, high oxalate foods can cause kidney stones. Okay, so when we're talking about kidney stones, literally, yeah, we're talking about rocks in your kidneys. And what happens is we all have particles in our kidneys, right? We can have calcium, we can have oxalate, we can have sodium, we can have uric acid. All these things float around, particles in our urine. And of course, water is what they're floating in. Well, one of the most common stones is a calcium oxalate stone, where the calcium binds to the oxalate. And so if you have a diet that's high in oxalate, that can definitely predispose you to calcium oxalate stones. So what has high oxalate? Ooh, should I ask that as a question? Now we got to get wrapping up. So things that are high in oxalate, tea. And I know a lot of people love tea, green tea. I love it. But if you're someone who's predisposed to stones, you might have to limit the amount of tea that you have. Consult with your doctor. This is information. Also, high oxalate, spinach. Y'all know spinach is healthy. It is, but honey, it's high in oxalate. So if you're someone who prides yourself on having your spinach salads and spinach in your smoothies and spinach in your juice, and oh, you got so much spinach because you're so healthy. If you have kidney stones, that spinach is high in oxalate and it could be exacerbating them. And also rhubarb. I don't know anyone who has rhubarb, but people do eat rhubarb pie, I suppose. Maybe that same lady who was talking about the study tonight, the tattoos and the lymphoma and all of that, she had an accent. And I think that a lot of people in the UK have rhubarb. Y'all let me know if I'm wrong, but I believe so. But rhubarb can be high in oxalate. But the answer is your question is yes. High oxalate can predispose you to stones, especially if you already are predisposed.
All right, 2 more questions. This next one
make sure you watch my video on the painful truth about kidney stones. I go into much more detail about kidney stones.
Oh yeah, that's a good one. This question came across twice about PKD. So Nana Love.
Hi, Nana Love.
I have PKD. Do you think it will be okay? I am 70 years old, woman, stage 4 GFR. And someone else has like stage 3B PKD.
Do I think what will be okay? Like life?
The PKD, having PKD, or just being her kidneys, I guess.
Well, you already know I'm going to tell you, consult with your nephrologist. But the honest answer is that if you have PKD, then yes, that puts you at high risk for kidney disease. And if for the two people who've asked the questions, if you've already progressed to stage 3B, and if you progress to stage 4 is a stage right before the stage where you're eligible for dialysis or a transplant. So the what is okay, it just depends. So is it possible by having PKD and being in 3B and being in 4 that you'll progress to being where you are eligible for dialysis or a transplant? Sadly, by the nature of the disease, since both of those are already moving towards being advanced, there is a high chance. Now, there are some things that can be done to slow down progression, especially for if you're still in the stage 3. There's certain medications that can slow down the progression of the cyst. So consult with your physician about medications. Maintaining good blood pressure can help to slow down the progression, staying well hydrated. But quite honestly, if you're already in stage 4, and if you do see a kidney doctor, this is the time to have very real conversations. But because by the time you get to CKD stage 4, it is standard of care to start having conversations about potentially kidney transplant. Okay. And at 70, you can get a kidney transplant. So you want to talk about that if you're interested. You don't have to be interested, but you definitely want to educate yourself on it. Here on this Dr. Frita YouTube channel, I have videos on hemodialysis, on peritoneal dialysis, just to give you an idea. You also want to have the conversation on, the medications that can help to slow down the progression, like the tolvaptan, those medications. Am I eligible for that medication? And what are the chances of it slowing things down? And you also want to have the other question, which it sounds like one that you might be asking me, but really your doctor who knows you, who can do the history and physical, can talk to you, needs to answer this question. The other question might be, okay, I don't want to do dialysis and I don't want to transplant. So how can I be okay like this? And if that's the question that you're asking, is real, Shador knows, we get it in the office. Yes, I'm in the business of saving lives. I'm also in the business of respecting lives. It's my job as a kidney doctor, and it will be your kidney doctor's job to explain all the possibilities, the medications, the dialysis, the transplant, everything. And it's your job to soak in the education, make sure you're well informed, but then you decide what's best for your life. But for the person really for both of you, I would have a very real conversation with your nephrologist about what can be done to slow down the progression of PKD. I would have a conversation about dialysis, about transplant, and then I would talk to your family and figure out what's right for you.
All right. Thank you, Dr. Frita. One medical question left, and then we'll be out of here.
All right.
This
What we got? Sure.
is V.E. Hall.
Hi, V.E. Hall.
Why empty bladder before taking your blood pressure?
All right. So very simply, having a full bladder, having that pressure in the bladder and sitting there and constricting the muscles and the sphincter that it takes to keep that bladder from emptying causes an increase in your blood pressure by causing your blood vessels to tighten. If you have a full bladder, you're actively sitting there, whether it's conscious or not, and you're holding your sphincter, right? You're keeping that urine in, and you can't fully be relaxed. Okay, so if you have an empty bladder, you can totally relax. There's no tightening of any sphincters. There's no Kegel exercises. So that's the main reason. And some of the other things, as we close, for making sure you check your blood pressure well, you want to make sure that your feet are flat on the ground, that your legs aren't crossed. When your legs are crossed, that's almost like a tourniquet that can make the blood kind of rush up to your arms, make the blood pressure falsely high. You also want the arm to be at heart level. If your arm is dangling down, that can give you a falsely elevated blood pressure. If the arm is high, for whatever reason, I don't know, that can give you a falsely low blood pressure. And you also want to make sure that you breathe in, you breathe out, that you're nice and calm. You don't want to plop down and check your blood pressure after you've been running around, hustling, fussing at kids, looking at the news, mad. You don't want to take it when you want to be in a relaxed place. But make sure you check out my video. I have a short here. And if you go to my Instagram, you can also see it. And I have a whole video, actually, how to monitor your blood pressure at home properly. And I'm also going to be adding a link there for one of the blood pressure cuffs, which is a good, reputable cuff for getting accurate blood pressures at home. But yeah, empty that bladder, please, so that you can be relaxed, not sitting there shooting that blood pressure up.
All right. Thank you, Dr. Frita. Now, inquiring minds would like to know, and then I give you your comments. Miss Melissa, she asked, where's Shadow today? I have not heard her.
Shadow is literally sitting right over here being good. And it's a shocker. Hold on. No, I'm not going to call. Yes, I am. Shadow, come here. Yeah, I guess she just feels like being good today. I'll tell you what it really is. That day where she was really just cutting people were eating and she was fussing like she's a human, like she paid some type of a mortgage or like she put something on the light bill. She was fussing and very boldly asking for food, but nobody's eating right now. So she's being good. Shadow, come here.
All right. Ms. Patney says congratulations on keep going on your certification.
Oh, yay. Thank you. Thank you. I appreciate that.
Mr. Randy says, I love Medical Mondays with you, Dr. Frita and Ms. Shador.
Yay, Mr. Randy. We love that you support us so much. I appreciate you.
Absolutely. Theopolis. Dr. Frita, you and Shador make my day. I really enjoyed the show today, and I love hearing from everyone else.
Thank you. And look, you just made my day. I appreciate that feedback. And, and again, please make sure that you like this video and you share it with the people you care about. If you found this information helpful, then likely someone else in your life will find the information helpful as well. It doesn't stop here. We've got so many resources right here on this channel with these videos. I love to learn. And more importantly, I love to share the information. And especially when we're talking about kidney stories, I'm not just guessing or talking about things that I've heard. I'm talking about patients that we see and we take care of in everyday life. So I appreciate those kind words. I do. So yeah, make sure you like this video, you subscribe, you hit the notification bell. And again, if you want to have a one-on-one conversation, click the link in the description for the concierge service. I got the concierge telehealth service. And for those of you dealing with blood pressure, which tens of millions of Americans are, and only about half have it under control, make sure that you also click the link and you get my book, Under Pressure, A Guide to Controlling High Blood Pressure. You can also get it on Amazon. And yeah, we talk about medicines in it, but we really talk about lifestyle and really the integrative way to live your healthiest, happiest life. All right. Well, that's it for Medical Monday. And we will be here on next Monday to talk about, again, all of the hot health headlines in the news. I appreciate y'all for your support. And I thank you, my co-host and my practice manager, Shador. And we'll be here again, same bat time, same bat place. Y'all have a good night.
All right, you too.